Hi, I'm Marty McGrady. I'm in charge of the staff at South Pole this season.
Angela Bailey. It's really nice to meet you.
Nice to meet you too. Okay. I see you graduated from Johns Hopkins in 2009,
That's right.
and you completed your residency there?
Yes.
And did you go on to specialize?
Not yet.
Why not?
Well, I wanted to get more experience as a general practitioner first.
Well, you'll definitely get experience in Antarctica. It'll be just you.
I understand.
Now, you've been highly recommended by Dr. Westfield, and your resume is fairly impressive. Valedictorian, National Honor Society, very nice. You've got the job.
Thank you so much, sir. I won't let you down.
All right, I'll send you the information for the pre-departure testing, and I'll set up a date for the team to meet. You'll need to complete the training modules before you leave, and I'll send more during the expedition to keep you on top of your game. Now, you'll need to familiarize yourself with the telemedicine system, because you may need to use it during your stay.
I'll get right on that.
Doc! Hey! Hey, Doc!
What's happened?
I slipped on the ice and rolled my foot.
Okay, let me look at it. Yeah, looks like it's gonna bruise. I'd like to take some x-rays, but I'll get you something for the pain first. Do you want the good news or the bad news first?
Bad.
Well, it appears you've broken the base of your 5th metatarsal.
And the good news?
Well, it's actually just okay news. There's not much we can do for it. So, I mean, it's a minimal break. All you need to do is rest and don't walk on it.
You're right. That's not good news.
Well, back home they wouldn't do much for it either, so treatment is the same. You just have to stay in base.
What about my research?
Tell you what, Emily and I will collect the data. We'll send it here for you to analyze.
I guess that's the best we can do.
Hey, I don't think so, mister. You gotta stay off that foot if you want it to heal. We're working on getting you some crutches. Sorry, but that's the best we can do right now. It's really looking much better. How's the pain?
Better.
What's wrong?
My chest. It's killing me.
Let me take the blood pressure. Okay, let's take a slow, deep breath. I'm going to take a chest x-ray.
What are you doing?
I'm getting on the telemedicine system. I need to talk to a cardiologist. Dr. Taylor, can you hear me?
Yes, I received the x-rays and patient history, and I concur with your diagnosis of myocardial infarction.
I administered 15 cc's of heparin when he arrived.
Good. Has his pain gone down?
Yes, and his breathing's returned to normal.
You've done all that you can do down there. I reviewed his previous stress test and it was inconclusive. I recommend evacuation as soon as possible. He needs another stress test and may require surgery.
Thank you. Understood.
Good luck.
Flight team. Flight team, can you hear me? As soon as the weather is favorable, we're going to evacuate. Let them know at Christchurch, New Zealand. Let's take a look here. looking much better. You should be able to walk on it again.
Thanks, Doc. How's Marty doing?
He's doing okay. He's recovering back in Montana.
Good. You okay, Doc?
No,
What's wrong?
I'm not sure. I think I just need to rest. I don't know what's wrong.
Doc, you've been sick for days.
I don't know what's wrong.
We need to find out what's wrong. You aren't doing anybody any favors by toughing this out.
I can't do any testing down here.
Don't we have an ultrasound unit?
I had like a day's training in radiology. I don't know what I'm doing.
Then order an evac. We'll take you to Christchurch, New Zealand, when the weather clears.
Okay, get me out of here.
Angela? Angela, do you know where you are? Do you know where you are?
New Zealand.
We need to get her hydrated and on oxygen. We need an x-ray stat. Give me an ab series too, stat. Where's the basis doctor?
She is the doctor.
Do we know what happened?
She's having abdominal pain, nausea, and vomiting, and she ordered the evac.
Okay, you know what? Get me an ultrasound too, stat. Angela, how's the pain?
It's an 8 out of 10.
It's a good thing you came in. You have gallstones. Here's your x-ray. Here's your ultrasound. Several of them have moved into the biliary tree. The bile can't pass, but it doesn't appear to have blocked off the hepatopancreatic ampulla yet.
Are you recommending surgery?
Yes, it's the best option, but we have extremely skilled staff here. The last thing we want is for pancreatitis to set in. I'm gonna need your consent.
Okay.
Okay, we're gonna take you right up. Do you have any family that we can contact?
Yeah, Emily should have my mom's number.
Angela, your surgery was a success. We removed your gallbladder and the stones. We performed an operative cholangiogram to check for residual stones. You can see here.
Okay.
Well, it looks like your vitals are good. I'm going to have a nurse check up on you and monitor you for your pain. You've got you pretty well medicated, so you should be comfortable.
Thank you.
You just rest, all right? And we'll have you better in no time.
How are you feeling?
Oh, I'm alright.
What are those?
These are some pictures the guys took during the evac.
It's a good thing they got you out of there when they did.
Yeah, if they hadn't, I'd be much worse right now. I'm just worried about them down there without me.
They sent an interim doctor down, didn't they?
Yeah, but I still feel like I let them down.
It's not your fault. These things happen. You can't help it if you're the only doctor. Just because you're the only doctor doesn't mean you aren't going to get sick now and again.
True. And you can't test for everything before you go down. I mean, maybe if I had an abdominal ultrasound, but still.
Even if you had, you can't prepare for everything.
It's so isolated down there. Life and death. It's a constant balancing act. One big mistake, and it's game over.